You're watching UNICEF television. At the Notre Dame of the Apostles dispensary in the Chadian capital of N'Djamena, hundreds of women wait patiently to screen their children for malnutrition. Every day, the dispensary is more crowded than the day before, a sign of a growing nutritional crisis.
Today, there are a lot of children suffering from kwashiorkor and marasm. In 2008, there were cases of malnutrition, but not like last year and this year.
The dramatic increase in the rates of malnutrition is directly related to the region's failed rains of 2011. Basic food staples are significantly reduced in the market, meaning food prices have increased.
It's because there is no rain. There's been no rain.
Khadija is a mother of 3. She brought in her 6-month-old son, Nawan, for screening after he fell sick with fever and diarrhea over 3 days. That was long enough to put him in the danger zone.
We have some trouble at home with having enough to eat. My husband is a motorcycle taxi man, but lately the money isn't enough.
Khadija is just one of over 10 million people affected by the crisis in the region. In Chad alone, UNICEF estimates that 127,000 children will suffer from severe acute malnutrition, and 300,000 will suffer from moderate acute malnutrition over the next 8 months.
This year is going to be very difficult because the parents don't have food at home and the children start to fall sick, and then there's no money for medication. And because they don't have money for medication, they don't come to the hospital fast enough. The child becomes too weak and malnutrition sets in quickly. If we don't respond fast enough, it's going to get worse. We will become overwhelmed by cases and children will die.
According to UNICEF data from 2010, 15.7% of children under 5 were already suffering from severe acute malnutrition. With the Ministry of Health, UNICEF has so far set up 276 nutrition rehabilitation centers and has plans to double the number in the next 2 months. At the same time, an integrated approach is being put in place to address the root causes of the crisis.
We know that in countries like Chad, approximately 50% of child mortality, of children under 5 mortality, is related directly or indirectly to malnutrition. We know that these emergency interventions are so important because it's really a matter of life and death. We also know that we have the capacity now to treat large numbers of children within a community setting. So these are relatively non-expensive interventions that are life-saving.
Advanced planning means that an emergency response is already underway, and supplies will last for the next 2 months. Beyond that, international support is greatly needed to keep the response going and save these young ones' lives. For UNICEF Television, this is Eva Gilliam in N'Djamena, Chad. Unite for Children.